Hi, my name is Abhijit Kikkeri, a health systems management major. I'm taking health economics this semester and I am doing a presentation number 2. The topic is turnaround time in troponin testing. It's the application of Lean Six Sigma. What is Lean Sigma? Six Sigma is a quality improvement process. Lean Six Sigma is a discipline that focuses on process, speed, and efficiency. The five laws are: customers are important, speed, quality, and low cost are linked, and eliminate variation and defects, focus on process flow, waste should be eliminated. Data critical to making sound business decisions. People have to work together to make the kinds of improvements that customers will notice. Teamwork is very important. The steps in Lean Six Sigma. It's basically called DMAIC process. D stands for define, M stands for measure, A stands for analyze, I stands for improve, and C stands for control. If you look at my presentation slides, you will see the definition more in depth. There are 7 types of wastes: defects, overproduction, transportation, waiting, inventory, motion, and processing. What I have chosen is waiting. Reduce wait time for phlebotomy results. Case study: troponin turnaround time. 47% of myocardial infarction deaths in the United States occur before the access of medical care. Application of Lean Six Sigma in emergency department will reduce troponin turnaround time, also known as troponin TAT, TAT. The goal is to implement process measures to reduce the emergency department turnaround time to less than 60 minutes. Design and method: identify, develop, and implement workflow made in emergency department patient triage. The result is after process improvement and implementation of new workflow model decreased the turnaround time to 0.75 hours with 100% efficiency. DMAIC troponin. D. Reduce troponin turnaround time through the application of Lean Six Sigma. M. Turnaround time, process mapping, observation. A. Identify opportunities for improvement. I. Emergency department interventions and laboratory interventions. And lastly, C. Document the new procedures, maintain staff training and competencies, ongoing monitoring. This is DMAIC, DMAIC. Here is a short diagram that I've done. What used to happen before was basically in the triage, the electrocardiogram was done. Then the patient was sent to the emergency department room. And after that, physician assessment. After that, physician troponin order. And then, lastly, what used to happen was the phlebotomist would draw the blood. But we can save time by doing this method here. First, in the triage, do the electrocardiogram, and the phlebotomy draw, then emergency department room, then physician assessment, and by that time, the results for the troponin testing would have already come. So that is what I recommend to be done. The after. The before takes way too long of a time. Now, process efficiency. Let's just say that before might take an hour and a half to get the results, and after might take 0.75 hours, which is 45 minutes. So the lead time before is 90 minutes. So basically, if you're looking at this, 45 divided by 90 times 100 is the process efficiency. Now, the after, the lead time is 45 minutes. So basically, we're looking at 45 divided by 45 multiplied by 100, which brings 100% efficiency. So before we had 50% efficiency, and now we have 100% efficiency. That would definitely save a lot of lives. And then I'm coming to my 9th slide, which is improve DMAIC process recommendation. Increased public awareness can help reduce wait time for seeking treatment for patients suffering myocardial infarctions. Lean Six Sigma technique can be applied to reduce troponin turnaround time. Lastly, cost-benefit analysis. Let me talk about this in depth here. Lives will be saved to curtailing of time in the new process of phlebotomy in the triage. Cost. Reduction in cost anticipated theoretically if troponin test results are obtained faster. Providing a more rapid result of troponin blood test saves time and therefore money. Benefit. Faster troponin result leads to earlier diagnosis. Earlier diagnosis leads to earlier intervention and better patient care. Reduced turnaround time of troponin blood test results will eventually save lives. Faster treatment leads to faster turnover of emergency department bed, reduction of unnecessary procedures, and lowered length of stay. This is all I have for my presentation today. The presentation again was on turnaround time and troponin testing, application of Lean Six Sigma. Once again, my name is Abhijit Kikkeri, a student of Health Systems Management class, Health Economics, HSMG 301. Thank you.